Your neck and jaw pain may be related to your tongue. In this video, I'll be answering questions like, how does tongue posture affect your neck health? What are the signs of poor neck alignment related to jaw pain? How to relieve neck tension caused by jaw issues? And finally, what are my top 3 exercises for neck and tongue? So with that said, let's go to the first question. How does tongue posture affect neck health? Well, your tongue is more than what you realize. The position of your tongue, which is ideally the tip of it is to the front of to the back portion of your front teeth, and the middle of your tongue most often rests at the top of your mouth, which is the bottom of your skull. The tongue positioning in your mouth allows your head to find its ideal place compared to the neck. So you have head movement and you have neck movement, and the tongue gives a lot of cueing for the head to see where it belongs to. So it makes a huge difference there. So alignment of your jaw and neck positioning now allows relaxation or tension, even chronic pain when it is compromised. The next question, what are the signs of poor neck alignment related to jaw pain? Well, that's pretty obvious. You get tension in the neck and you get headaches. How? When the head positioning over your neck is not ideal, the movement of head over the neck and neck over the body changes. The muscles that have to perform the task that they are designed to perform no longer get to practice where they shine at. So that leads to other parts of your body trying to make up what is needed. So that creates tension headache, which is the tension of the muscles in the back of your neck that are in charge of your head movement. And then the tension, cervicogenic headache, which is the tension in the muscles of the neck in charge of neck movement. So you can see that that comes with pain. The next question is how to relieve neck tension caused by jaw issues. Well, you want to be able to differentiate the head movement from the neck movement. That is 100% the basic thing that needs to happen. The next thing is you want to practice both head and neck movements and exercises related to them. I'm going to do those exercises in a little bit. Then you want to take multiple breaks from looking at your devices. When you're looking at your devices a lot, your head goes forward and it's just a matter of time before your neck goes forward. So that changes the position of your head over your neck and the position of your neck over your body. That if you're having, let's say, notification on your devices and you're constantly looking where your notifications are, or you're just tiny bit looking off to the side because that's where your monitor is, for example, your devices are. So those little movements will create that imbalance between right and left side. And if you're thinking, geez, I'm so fragile, no, you're not fragile. What is causing the issue is the length of time of off balance that you stay at. And of course, you can't deny it. So right now, I just went down into this position. If it was up here, in order for me to see the camera, I'm looking down a little bit. I didn't like it. I can already feel the tension in my neck. Perhaps because I'm aware of these things. But when you're not aware of it, you don't even realize. So I'm going to go here, which places my eyes a little bit closer and more leveled with the camera in this case. So these things make a huge difference. You want to be able to take multiple breaks, like I said. You also want to do those exercises that I told you about. So what are my top 3 exercises for neck and tongue? You want to get in the habit of really checking your tongue positioning. I mean, if you're thinking, geez, now I have to do that, yeah, you do, unless you don't, and then you deal with the consequences of it. We don't have a natural life like you would have ideally wanted to have, like probably our ancestors, not even too many generations ago, had. We don't have that natural activity that we used to. We have more sedentary, and sedentary means prolonged sitting or standing. That's what it boils down to. So when it comes to my top 3 exercises, I 100% talk about biological breathing. Biological breathing is what is needed for or what actually reinforces what we need to have with the most ideal connection. I've done videos on biological breathing. I'm going to make sure that there's videos of that going at the end of this video. And if this is a reel and you're watching this, just type in biological breathing and I'll send that to you. The next thing that we want to do is what I just did. So let's pretend, and I like doubling up my exercises with activities I do throughout the day. So let's say you're sitting on the toilet. If you're sitting on the toilet, if you place your hands on your knees, and instead of sinking in like so the side view would be this, you press your elbows onto your knees, onto your thighs, and glide your neck up, not tucking your chin in like so, but releasing some of that tension here, and then asking the muscles in the back of your neck to glide the neck up. So if you place your tongue to the roof of your mouth, those muscles get alerted that they need to work. So place your tongue to the roof of your mouth, place your elbows on your thighs, and glide your neck back and hold it in that position. When you do that, you're actually working out a muscle that's not used to being worked on. And that is how we activate and we practice. I didn't mention anything that you do in isolation. This requires your whole body's cooperation. Very, very important. The last one that I really, really like is what we all did at age 3 months. So what that's gonna look like is you're gonna be on the floor and you place your hands right under your shoulders, and you're thinking about your shoulder, the top of your shoulders going towards your elbows. So they're going towards your elbows, and your elbow down to your hand is the direction of force. So it's as if your hands are going to slide, but because there's a downward pressure into the ground, you won't be able to slide it. So you're placing your nose on the ground, your forehead onto the ground. Try to slide your nose up until the tip of your nose is off the floor. Go a little bit more and hold your head in that position. Send the top of your shoulders towards your elbows and elbows to your hands, and you lift yourself up. Make sure you're breathing biologically. Your feet are not coming off the ground and you're not squeezing your glutes. When you do that, you're allowing your head and neck and the upper part of your shoulders shoulder blades, and your arms. That's the group, that's a mini concert that is playing. They all work together as you're breathing biologically, allowing the communication within the trunk to be close to ideal. When you do that, you're actually working on activation, connection, and implementation of a task utilizing your body parts. This is the difference between working out an area in isolation versus in connection with the rest of the body, which does not happen. When you practice nasal breathing with your tongue lightly pressed to the roof of your mouth, this helps reduce tension and improve posture. That is the reality of how your body works. If you provide the grounds that your body parts shine the best, they know what their functions are, they know how to do the task. I always say, you drop an acorn on the cement, it will never become an oak tree. You put it in a fertile ground, it has a better chance. It is then that the acorn knows how to become an oak tree. You got to provide the grounds that your body parts, that allow your body parts to do what they're best at. When you take them out of their element and you ask the body part to perform a task that was not its primary task, you will not get the optimal result. This is so important, and I hope it makes sense to you. Please like and comment, and make sure you share this with someone who can benefit from this. And until next time, take care.